Adjuvant immunotherapy is an emerging trend in oncology, but which tumors can be treated with this approach? Which are the potential benefits and risks, and which are the unresolved issues? We asked these questions to Professor Paul Nathan during the Immunotherapy Bridge meeting that is ongoing in Naples, Italy. Today, here in Naples, you have talked about the implications of adjuvant immunotherapy. That's undoubtedly a hot topic. For which tumors adjuvant immunotherapy is today a real possibility?
Well, at the moment, melanoma is the only tumour for which adjuvant immunotherapy is a standard of care. There are lots of studies going on in other tumour types. I think the key thing is that immunotherapy needs to be shown to be highly active in the metastatic setting in a given tumour type before it's likely to be active in the adjuvant setting.
During your presentation today, you told us that when it comes to systemic adjuvant treatment, there are at least three aspects to consider. The first two are the risk from the disease, and on the other hand, the benefit that can be gained from adjuvant treatment.
Yes, I think it's really important when one's talking to patients about adjuvant immunotherapy that they understand what the risk is for that patient, both from the disease and the improvement in risk given by the treatment. It's an obvious thing to say, but one needs to talk about absolute risks, not relative risk. So with immunotherapy for melanoma, we can have a 50% reduction in risk, but if it's a 50% reduction of a very small risk, it might not be worthwhile for the patient.
The third important aspect you mentioned is the safety of treatment.
Safety is really important in all patients having treatment, but particularly I think the adjuvant patients, because a proportion of those adjuvant patients would have been cured by their surgeons and will never relapse. So in other words, they don't have cancer. And therefore one really wants to be careful about exposing patients who are not actually at risk from their disease, it's just that we can't identify them, to toxicities that are significant from treatment.
In your talk, you have said that it's also of paramount importance to find prognostic and predictive biomarkers for the adjuvant immunotherapy. Which is the landscape at the moment?
Well, there are two important types of biomarkers we need. The first is that we need prognostic biomarkers to identify which tumours are higher risk and therefore identifying which patients should be treated. That's the first challenge. The second challenge is, particularly in melanoma, because we have options for immunotherapy-based adjuvant treatment, but also non-immunotherapy-based adjuvant treatment with BRAF inhibitors. It would be wonderful if we had predictive biomarkers to identify which would be the preferred type of treatment.
Finally, which are the other issues still to be addressed, and which the perspectives of adjuvant immunotherapy for the near future?
Well, the greatest need is whether or not this approach is useful in other cancers. And there's an awful lot of activity going on with multiple adjuvant studies going that are currently recruiting patients in a variety of other cancers. And so we'll learn shortly whether or not it's not going to just be the melanoma patients who have benefit.